All right. Here we go. All right. So welcome everyone. Thank you for joining in. I'm going to explain a couple of things that we've gone through that we deal with a lot. We've been doing this for a while, so we want to answer a lot of questions that we hear a lot. So again, I'm Aaron Robles. I'm owner and CEO of Innovative Therapy Solutions, and we're doing business as, Innovative Physical Therapy, and John gets physical therapy. So now let's go through. So one of the things that we deal with a lot is people who have a lot of back issues, some back injuries. And it seems like as we're kids, when we're younger, we didn't have these kind of things. As a kid, you could see them running in a park, running full out, and they'll trip and they fall, they do a tumble, they get up right away and keep running like they haven't missed a beat. As adults, we could walk across the floor in the living room, stub our toe on the carpet, and our neck hurts. So that's where kind of we deal with. So what happens is as we get through and try to get more active, our body sometimes pushes back, especially our back. And it could be debilitating and doesn't let us do what we want to do. So what happens then is when we have kind of issues or pains, kind of look that up. So we're trying to find answers. And this is where we get a lot of frustrations met from our patients. And this is where we like to address some of those. And we want to hear what we hear a lot from our patients is when they go see a doctor for the first time and try to find out what's happening with their issues. And they try to find expert advice and they don't get it. And this is why we get frustrated. And that's when they find us, often the first day, they're like, I wish I would have found you sooner. And why that happens is because what I call people get stuck, especially when they have back pain, on the medical treadmill. So let's say you have back pain that you try to, stretch it, rest it, ice it, and try to let it go away, and it doesn't help, and you finally go see the doctor. And so you step on the treadmill. So once you get and see the doctor, what do? They do some imaging. They may do some x-rays. And what happens with the x-rays is they may not find anything. So they'll give you some pain pills and muscle relaxers. They often do. Come back in a month if it doesn't help, and we'll see what else we can do. So you try it, it doesn't help. So you come back in a month and they send you to a specialist. So somebody more, an orthopedic doctor or neurologist for your back pain. So when they see you, they want to see more imaging. So they take maybe MRIs or CT scans or more and test it for you. And if that doesn't find much to it, and then they may offer you injections, maybe stronger medications, or even, surgery, if so, if it's needed. And if that doesn't help, you go to another specialist where typically it's just a pain doctor, where they'll just give you shots and give you more medications when it hurts. So now what happens is, what our patients are, they get stuck. They get stuck in a where we call their health journey, because they didn't get any answers that they needed, because they sought several experts. And then when they push them further, well, why doesn't any of these treatments help? Is because, what they'll do is they blame it on age, or, what they'll say, well, if it hurts to do that, the old adage, it hurts to do that, stop doing it. So they tell you to stop, doing what you love, stop playing golf, stop. If you wanted to walk on the beach, I guess you can't do that anymore. Or even worse, sometimes they tell you, well, it's in your head. So this is where we get a lot of frustration from our patients. So I want to show you a study and we'll give you some examples of why this could happen. So this is a study showing you people who they took had no back pain or issues whatsoever in their back, and they did imaging on them. People for each decade from 20 to 80 years old, as you can see, they found a lot of significant things in every age group. Now, again, these are people who had no back pain, and this is the stuff they found on them. So if you take this person who goes and does yard work too much on a Saturday and hurts their back. And then when they go see the doctor and they see this imaging, what are they going to treat? Natural assumption for the doctor is to say, okay, this is what's wrong. This is what's causing the pain. And they treat what they see in the imaging. But that's why it doesn't help, because that's not the issue. Because they had this before, they had their back pain, and it wasn't the true cause of what their problem was. And that's why they could have failed treatments. So then on the flip side, you may have x-ray like this. So I have a patient that has x-ray just like this. And I agree with the doctor. When the doctor sees it, they're like, you know what? You shouldn't be walking, let alone, worrying about what you want to do. And this is a 70-year-old patient of mine who is a high-level athlete, and he wants to compete in national champ competitions in rowing. He's actually ranked top 5 in the nation in his age group. And he came to see us just because he couldn't get his knees back. He could keep his knees together in his form. So what we do and what we're successful at, let me stop this for a second. And what we're successful is addressing these issues, because how we get to the root of the issue is to get to what their body tells us what's happening. And that's what we want to do. We want to do is say, all right, yes, we'll take that information of what the imaging says and what everything's fine, but we really truly want to do is not let that dictate what we do for you, is to tell us what's happening, why does it hurt, when's it hurt, and try to help guide us to get to the root of the problem, take all that in effect, okay? So I like to address a couple things here. I'm going to share my screen again. And let's see here. Let's go to this one. What I want to do is myths. These are some myths that people with back pain have. Myth number 1, when it hurts, don't move. Just rest. Don't do too much. Rest till it feels better. Unfortunately, if you have a dysfunction, the rest doesn't help, because once you start moving again, it hurts again. And people feel like, the more I do, the more I hurt, so it has to be worse. But sometimes you have to keep things moving and get your muscles back engaged, especially if it's a mechanical dysfunction, to help get your muscles working again, so that way it doesn't keep overworking the wrong way. And that's what helps to keep things moving, keep things loose. That's why I say all back, you're often told, just walk and keep moving. That's what we want to do. We want to get your body used to moving, not get overworked. Now the fact, oops, sorry, that's so blurry, that I should avoid exercise, especially with weight training. Well, sometimes if you don't know what's going on, yes, you should do that. But some studies found that if you continue to keep the muscles working in the right way, even when it hurts, it could be beneficial for you, even if you're doing any resistance. But obviously, this is after, we find the root of the issue and that you're not going to overwork your back. Number 3, as we show, and this scan will show exactly what's wrong, as we showed you with the study says you could find things, but it's not necessarily what your back issue is. So that's where people always want to get let me get the MRI first. So sometimes, or get the X-ray first. And like I showed you with the 2, examples, it can give you some information, but doesn't exactly tell you and give you the root of the problem. And then 2, pain equals damage. Sometimes you have pain because your body wants to protect against something, and it's not necessarily that's something that is broken or torn that you can't overcome without having some kind of surgery. Okay. Any questions so far? Does that make sense? So what we want to do is just kind of help you understand what we want to reach out to patients when they have kind of issues with their pain, with their back, and why is it happening when they're happening. So let me share my screen again. Okay. Back to, oops. Back to my screen. Oh, here we go. So what happens when we have back pain, this is how your body reacts to it. It wants to protect your back. So that means it's the strongest muscles are going to start engaging and over engaging to help protect your back. And that's where here you see the back extensors right in here. These muscles are big and strong, so they're going to tighten up and lock up, and they're going to move first. So they want to hold you, say, hey, I got you, no problem. You know, Kurt, if your back hurts, I'm just going to protect you. I'll move you and protect you at the same time. But what happens is your core, when you have pain, shuts down. That's why your abdominals here are part of your core. There is actually a study that shows whenever you have back pain, your core automatically shuts down. But once that pain is gone, the core doesn't automatically come back. You have to force those muscles to come back. That's why it's so popular to do all these core exercising. Okay. So what other happens is your glutes and your hamstrings shut down as well, because that's what's keeping you from allowing your back muscles to overwork. So that's where it happens is these muscles have to shut down and not work in order to let these other muscles overwork. And then in the front here is your hip flexors. Your hip flexors also start tightening up to protect your back. Now you have an imbalance of your back. So because of this imbalance, it causes bad posture. And when you don't have good alignment of your spine, anything you do, even just sitting or standing, will cause extra stress on your back, your muscles, and your spine, which could lead to degenerative disc, could lead to arthritis if it goes on too long. And these kind of things that what I say is really good. The best anti-inflammatory that you could have is actually good alignment because it takes the stress off your body. Because this what if you constantly do any of these postures, we call this cumulative trauma. It'll cause this pain over and over again and keep inflammation in your body, which keeps you in pain, which keeps you in these bad postures. So you get caught in a cycle, a cycle that's hard to break. And as you can see here, these are the pressures that goes in your back for just standing, the amount of pressures of force the compression force on your back in these different positions. And this is where even sitting, people think, why does it hurt to sit so much? And you can see how it's like more than double the pressure on your back than just standing upright. And so some people have to have a standing desk if they are sitting at a computer all day. And it helps take the stress off their back. So those are kind of some of the issues that people have, and this is why it keeps going on and doesn't stop, kind of going with your back. And these are some things we want to do. So what happens is then we have to correct the imbalances. So when you have pain for a long time, and this is where we often see it, we rarely see patients that, hey, Aaron, I was fine on Friday. Saturday, I went to lift some mulch and I twisted my back, and now my back hurts. And now I'm here on Monday. Because if I press a part of their back that hurts, then guess what? If they just happen to them, that's what the issue is, and that's where the problem is. The problem is, I don't see that patient. I see that patient who comes in for their back pain, that they hurt their back lifting mulch 10 years ago because they thought it'd go away. It didn't really debilitate them. So they tried to do other things, but it just wouldn't go away. And it keeps getting worse, getting worse. Now they're at a point where they can't even bend over to brush their teeth because their back hurts so much. That's when I see them. So now when they get to that point, your body gets into those postures of protective mechanism and a lot of compensational motions. So they have a lot of things going on. So when that patient has a lot of layers of issues going on with their back and they go see the doctor, the doctor can only treat the symptoms at that time. So that's why we have to do here is try to understand what is the root cause. When the root cause is addressed, like with imbalances and then the mechanical problems with your back, then you could actually get healing done and get the proper way your body's supposed to be positionally, and the proper way your body's supposed to move with the correct muscles and the right sequences, then you could do more without having pain. Because most people have like this capacity before their back hurts. And then when their back hurts, now they can only do this much. So, and then as long as they stay in this range, they're okay. But if they have to step out of the range, and then that causes back pain, and then the range gets smaller and smaller. So I used to be able to walk 3 miles on the beach without any issues. Now I can only walk 1 mile. And that because now when they stay in that range of 1 mile, they're okay. And that's why they can have pain for a long time. So eventually this range gets so small, they can't do what they want to do. Then they seek help. So what we want to do is make sure you keep the range, okay? Keep it where you can. And that's why we want to keep your body moving, but as long as you're moving in the correct way. So one of the exercises we want to do, and we always emphasize in our treatments as well, and let me treat that again. Let's see what's happening here. Is this, okay. How do I get back to my Zoom screen again? I'm going to share my screen again. Okay. Okay, can you see that?
Yep.
So on the far right, this is a correct bend of utilization of how your spine and your pelvis and your hip joint works. What you want to do is bend mainly at your hip. This is somebody on the right, far right, is bending straight at their hip joint and only their hip joint. This is how much motion excursion you have bending forward and just using your hips. You're not using your pelvis or your back at all. So what happens when you have dysfunction, your back tightens up and doesn't allow you to move. You can see on the far left now, here's a motion where you have some limited motion at the hip. So your back has to take some of that motion, but your pelvis gets more of that motion than your back. So your pelvis says, I'll overwork here. And that you can still touch your toes and you think, yeah, I'm still flexible, but you're moving a joint that's not supposed to move that much. And over time, your body will push back, lock up, and then you'll be like the person in the middle. Now your hip joint doesn't work, your pelvis doesn't work. Oops, sorry. Your pelvis doesn't work. And now you're stuck with just your spine and your lumbar spine doing all the work. And this is where your capacity goes to minimum because your spine is only supposed to move a little bit and complete the motion as opposed to doing most of the motion from the hip joint. Okay. Let me show you what I mean by that. So this is your pelvis and this is your hip joint here. So most of the motion, see it's a ball and socket here. So most of the motion should happen if you're standing upright is to move at the hip. This is as far as you can move. So eventually the soft tissue in your joints will say, okay, that's as far as you got. So when you move forward, this is almost past 90 degrees and most people can get past 90 degrees just from the hip joint alone. So once you hit to that level, and then your pelvis here, this big bone we call your nominate, starts to move a little bit on your sacrum, which is right there. The sacrum is the bone at the end of your spine. So that moves a little bit, engages your sacrum, then your sacrum moves a little bit, then engages your lumbar spine, and then your spine moves. So your spine, your sacrum, and your nominate should just do a little bit of motion. So the main motion should be all here. So what happens when you have back pain, because a lot of your leg muscles are strong, they lock up. When they lock up, they don't move at all. And then all this locks up and often gets a dysfunction here. And this is where most of our patients come in with their back pain because this is now not in alignment, it's twisted. When it gets twisted like that, it does not show up on imaging. That's why when people do x-rays and everything and MRIs, it doesn't, and that's why you don't find that issue and doesn't address the real true pain. Once we correct that motion, and then all of a sudden their pain is gone, then they could move normally again, and they could stand correctly, they could exercise again, engage your core. So now their capacity goes from here and slowly gets back to where they need to be. And that's how we kind of address also back pain. So the exercises, what we need to do to keep your back free and loose and keep stress off of it, is keep this hip joint moving freely. And there's a lot of things that you can do to keep this joint free. Because if you don't keep this joint free, then your back has to do the motion. And that's the old adage of use your legs, not your back, is true. As you see, most of the motion is supposed to happen here at your legs and your hip joint, and take the pressure off your back. Okay, does that make sense so far?
Yeah.
So good?
Absolutely.
Good. All right, so hopefully that answered some of your questions. So now I'd like to open it to you guys. If you any more specific questions you may have for, what could be causing your back pain or back issues.
How does it come and go? I mean, yeah, I know people that have really bad back pain that it comes and then they do some stuff and then it stays away for a while, but then comes back.
Okay, yeah, that's a good question. So this is what I hear often from our patients, like, I throw my back out, once or twice a year. I have to rest for days, sometimes a week. And then once they rest, then they're okay until they do something wrong again. And that's what I was talking about, the range. So they typically have a capacity of this motion of their back. They go too far, whether they, stressed their joint too much or they stress their muscles too much. Now they hurt their back. So then now you're back with the pain and constrictions of the motion is only this far. So what they do, people will rest till their back feels better. They're not better because they throw themselves out of whack. They just feel better. So now they have this capacity. So as long as they stay in this capacity, they're good. Everyday work, movement's good. And all of a sudden it's like, hey, let's take a trip to Disney. That's outside the capacity, then they throw their back out again. And that's why it could come and go. Because what happens, your body says, I don't like pain, so I'm just going to not do that. And as long as you stay in a range where it doesn't hurt, you're okay. And then once you step out of it where you can't help it, and sometimes you don't even know you can't do that. And that's why they throw their back out a lot.
So how do you cure that?
So you have to get to address the issue in the first place. What caused the pain again? And like I said, one thing, a common issue is what happens, you twisted too far and this joint here just twisted too far or it got stuck and it couldn't come back again. Because what's supposed to happen with this joint in here, this is supposed to move like this. It's supposed to move forward and backwards because it moves with your legs. As your legs move, this moves. And all of a sudden, sometimes you go too far, take a split, you reach too far, picked up something too heavy, twisted something really heavy, and it went just beyond the capacity where it's supposed to go and get stuck there. Now it can't come back forward. Now that you're stuck backwards, you can't go forward. Some people who are very flexible can say, okay, that's no big deal. You're stuck on this side. You stay stuck. I'll just move more on the other side to make up for it. And then that's why they say, okay, I rested, I felt better. This is where now I could keep going because this side's helping me. And then eventually this side gets the capacity beyond its capacity. It gets stuck. Now you got nothing. So what we have to do now is get this back and find out what the issue is and fix that problem. Once you get them back moving, then you have to train the muscles to work correctly again to keep it in place, depending on how long they've been out of whack. And the longer they've been out of whack, the longer it takes them to get back in whack. That's why you have to really engage the core. Avoid the exercises that move it out of whack until you get your core engaged, and then you can go back to those kind of activities. So that's really basically the core of what we do, is try to really get down to it. So let me show you another, to address that question. Let me show you another slide here. Okay. I don't know how to switch back and forth between a Zoom and this thing, so I'm gonna have to do this again this way. Okay. Screen sharing has failed to start. Try again later. All right. It doesn't like my screen shift. All right. There we go. Can you guys see my screen again?
Yep.
So this is how we address issues and how we fix things. We believe that we can't really get to the root of the problem unless we put our hands on and actually feel what's supposed to be happening and where it's not happening. And that's what the manual therapy part is. Once we find that and what's actually going on, it's the education part. Now, why did this happen in the first place and how do we keep it from coming back? And the two questions I get a lot. And this is where we, just like I was showing you with the spine and the pelvis, of telling patients, this is what happened, this is why it's hurting the way it is. So now we have to get it back, go back to the manual therapy realm where we are now getting your back. And what I tell patients, we have to enable your body to move correctly before we can expect you to move. So some people go to PT and or try exercises on their own and give them exercises and only exercises. And they feel like, well, the more I do, the more I hurt. Some people go to Pilates and yoga and these things that are supposed to help you with back pain, but the more they do, the more they hurt. They even hire a personal trainer to teach them how to do the core exercises. But because you're dysfunctional and you can't move correctly, you don't have that capacity to do that. And that's why we have to get you back in place, enable you to move, tell you what's going on, and then we have to build that capacity slowly so that way you can do more and get back to where you're doing without having those issues again in the future. And most of my patients can get back 100% to where they were before without having any serious issues if we follow this dynamic. Okay, good. Any
So
other questions?
yeah, I have a question. And so you mentioned a small thing. Well, not a small, but less intense things like yoga and Pilates and all that.
Yeah.
Now, let's say for me, 60-year-old, and I have disc bulge, as you showed in your diagram. Yes, and almost everybody has at 60.
Yeah.
And just 10 years ago, I was playing tennis, and I played just 15-20 minutes, and my back started to hurt, and my orthopedic guy said that, oh, you shouldn't be playing tennis because you have disc bulge. And so hearing you, I mean, you get the sense that you could play at least not 100%, 50% tennis. But then on the other hand, your orthopedic is saying, hey, don't play tennis. So what gives? What is
Exactly
your take?
right. Yeah. Like I said in the beginning, right? It's like, because the doctor sees that disc bulge and they treat that. If it doesn't help, then they're like, well, then stop doing it. What hurts you? Tennis. Well, stop playing tennis. That's the only answer they have, right? So for us, we want to truly see, is that what's happening? Because we want to correlate what you say is wrong to what you say how it hurts. Like if it's a disc bulge, which you should, and if it's actually affecting you in a way that it presses on nerves where you have shooting, burning pain down your leg, and the more you bend, the more it hurts, then yes, that's from the disc bulge. But if you don't have that kind of pain, it's not the bulge. It's something else. And that something else, typically something that could help you, that we could actually get better and help you get back to playing tennis. So that's a good question because I hear this a lot through. So yeah.
Okay, no, that makes sense. And no, I don't have any of those sciatica or shooting pain and all that. I did see Taylor Mixel earlier, and yeah, I mean, it seemed to have gone away, and then I know things got, like the other gentleman said, yeah, it just comes back.
Yeah, exactly. Yeah, that's true. So what happens is then is like, yeah, you reach the capacity of what you can do, And that's what your back's telling you. You say, all right, that's it. That's as far as I can go. And that's why that warning system is that pain. So that's what we have to do, is that we have to kind of slowly build your body's ability to get back to, the capacity it wants to do and what you want it to do. And like that's what the imaging helps, is see what is the potential of full capacity. And like you said in that study, everybody has something, right? Even the 20-year-olds had a lot of significant issues in their back, but it doesn't keep them from being active and keep them moving. It's just a warning that, if you do too much, something can happen in the future.
Okay, makes
That's
sense.
how.
Thank you. Yeah.
Good. Any other questions? All right. Since we have an issue, tell me then, Kurt, what's happening with your back? What's going on?
Well, mine's the SI
Right.
issue. And we work with you're stretching it and the I guess exercises. And so
Yeah.
it helps. It comes back once in a while. And I can correct it most of the times fairly
Yeah.
quickly. My mobility has gotten better because
Okay.
it's my mind, I think, as you've taught me, that's stopping me from, going upstairs or going that. And so I'm working on that. So
Have you
that's,
been able to get up the steps now?
yeah,
Better?
yeah,
Good.
yeah, much better.
Good, good,
Yeah,
good, good. Excellent.
yeah.
So that's what's good. Like you said, that's a big part of it, right?
Yeah,
So
it is for me. And I didn't know that. It was just falling a couple times. It's your mind just saying, I'm not going to let you do that. I'm protecting you. And
yeah, yeah,
it doesn't say it consciously. It's just, you know,
yeah,
you have
for
to get
sure.
over that hurdle. And that's a tough hurdle, I think, that I never thought of. Playing ball in college, I always heard people that had these bad injuries, and when they come back the next year, they were hesitant. And I was going, I don't understand that. You're running, and but
Yeah.
it's true. The mind is a powerful, powerful.
Yes, exactly. Yeah. Yeah, your mind is definitely one of the first people to say, hey, it hurts to do that. Don't do that.
Right. Right. Yeah. Walk a
Even
little slower. Walk.
yeah,
Only have a half step. Lean this way. Compensate with these other muscles, which it's doing, and you don't even know it. Really, I mean,
yeah,
it's tough. It's tough to figure out
yeah,
by yourself.
sure, for sure. And that's what happens. And so that's what sometimes that's what helps to limit people's ability to get back faster,
Yeah.
because your body's still not saying, hey, throwing out those yellow flags. Oh, I know it doesn't hurt like it did before, but it might. So I'm not going to let
Right.
you quite do that yet, kind of thing. So
Yeah.
yeah,
Like you were telling me, said your mind is reminding you, you took that step and that hurt. So let's not take that step. Let's do something else. And it takes some time, some
yeah,
perseverance to get through that and control your mind a little bit, just say, I'm going through it. I can make it. I'm strong. You have to be confident. Yeah.
yeah, exactly. And that's what one of the myths that, this is what you were talking about. Is like, weight training is wrong when I have pain, but sometimes, the pain is not, if it's not the dysfunction or the problem, it's just the warning system that your body still don't trust you. So
Yeah.
sometimes you could push through that. So that's what, with supervision and guidance, as long as there are times where you can push through pain, things.
Yeah.
And it gives you that confidence to say, okay, Aaron said I can push through it, so I'm going to push through it. And then the body says, oh, that hurts, it hurts. And all of a sudden, after several times, oh, it doesn't hurt anymore. And then because your body's convinced, all right, oh, that is not actually bothering me, so I'll let you do it now. And that's
Yeah.
what slowly you have to build that capacity back up.
But
For
but
sure.
it's a long road. It's
It
not
is, it
easy.
is.
I still have to work on that. I still have
Yeah.
doubts. I guess I don't know if it's doubts, but I still have cautions or
Oh, yeah.
whatever.
Yeah. Yeah. And hesitancies before it.
Yeah,
Because, yeah.
hesitates. Yeah.
Yeah. Sure. And great. How about you, Shashil? Any particular issues that you're having?
Um, yeah, I'm basically, I think the capacity has been dwindling, and I'll stop lifting weights because I like McNeil said that, yeah, your mind says if you do that it's going to hurt. So slowly cutting off the weight. Not that I was lifting heavy weights, but just weight training and things like playing tennis, just cutting off on those, and then you start wondering, like, if I keep cutting, I mean, what am I going to be limited to? Just
Yes,
2 years ago,
exactly.
I was able to do 90%. Now I can't even do 40%, and
Gotcha.
that's where you need help. Yeah.
Yeah. Yeah. You get to it. So what have you been, what have you done to help with that back?
Um. So, I mean, I had, actually, I heard your story. You moved from Atlanta to Jacksonville. I actually moved from Jacksonville, being in 25 years, to Atlanta, and I
Oh,
was
yeah.
just very recently, and I was Jacksonville. I was going to Taylor in the Perimeter Park,
Yeah.
um, and so that definitely helped at that time.
Okay, good.
I'm still trying to figure out, because of my relocation, a good physio. I
Yeah.
haven't found it. Let me just say that I was going to Innovative there in Jacksonville. I haven't
Yeah.
found a good one. The one that I worked here with didn't quite give me the results. So I don't know. I mean, maybe do some online. Like, do you get? I think I had asked Taylor. He says no. We can't practice because of the legal thing. We cannot give you advice in Atlanta. So I guess where do we go? Where do we go from
Yeah.
there?
Oh, yeah, we could definitely do online stuff. And we do that now,
Okay.
through, but, hey, send me an email if you would,
Okay.
um, of the area where you are, because being from Atlanta, I still have friends there that are physical therapists that are good ones. And
Okay.
if they're not close to you, I'll ask them for recommendations of somebody good and that's close to your area where you'd
Okay.
like
I
to.
will. I'll send
Okay.
you that. Thank you.
Yeah, because I'll definitely, hook you up there. The good news is the techniques that we do is called functional mobilization, and one of our main instructors lives there and is there in Atlanta. So the bad news is she's such in high demand that it's hard to get into, but her clinic, they have therapists like I have, like Taylor is not certified, but he knows all the techniques and practices it that way. She has therapists in her clinic are the same. They all practice that way, even though they may not be certified at the moment, but they're in a process of doing that, and they treat the same way.
Okay. Awesome. I'll send you an email. Thank you.
Yeah, send me that to me. Love to connect you with somebody good there. So,
Thanks.
all right. How about Brenda? You have any questions?
I don't know if I have a question, but I do like that you address education in your diagram, because I mean, even with the issues I have, I think it just was important once I started to understand why, like, my thoracic back, like why it was hurting and what was getting locked up. Then you start to like recognize the symptoms earlier, and then you can try to address them yourself earlier. And then if you see that you're not able to get moving in the right direction, then you can get back to your therapist more quickly before it becomes like a big issue. So I think education's a big part of it. And I think all of our therapists do a really good job of educating as they treat.
That's good.
Yeah.
Good point. Very good point. Well, I thank you guys for coming on. especially from Atlanta. That's great. Brenda's born and raised there in Atlanta.
Yes.
Okay.
That's
Love
real.
it.
Thank you, Aaron. Appreciate it.
Yeah, thank you
Thanks,
guys.
Aaron.
Yeah, any other deeper questions, feel free to email me, text me, call me. Love
Certainly
to
will.
talk. Thanks
have a
again, you
good
guys. Thanks for
Thank you.
sharing your night with me.
All right. Thanks for putting us on.
All right. See you guys.
Right.